Hey guys, it's me, Jax. So I'm about a month and 3 days post-op, maybe 4, 5. Who really knows? I think it's a month and 5 days. Yeah, roundabout if you count from Mondays. Uh, so the week after, I went in for my post-op appointment to see how I was doing and to get, well, it was about 10 days to get the staples removed, all 50. And it came out that I had ovarian cancer. They're saying it may be stage 1A, which means it hasn't spread, but they're not sure. So February 2nd, I go in, I have to get my appendix, lymph nodes, and some fat tissue taken out. As of right now, I've lost about 45 pounds through this surgery. The cancer thing's kind of been weighing on my mind a lot. That's why I got this. Also, it's more or less been taking a toll because I'm right now waiting on a test result for the BRAC1 gene and the BRAC2 gene, which, if I am positive for either of them, raises the risks of other cancers, including breast. One good thing about it, if I am positive, my insurance will cover my top surgery. But there's a lot of negatives with it. Because, one, it takes so long to come back, this test. It can take up to 2 months. 6 weeks to 2 months. So, it's kind of one of those, hold your breath and wait. But, yeah, so it's been weighing hard on us. I was in the hospital for 5 days after the surgery, and it came down to, I went again, I went to the gynecological oncologist. Some words are kind of hard for me. And she checked out my wound and noticed that it was infected, real hot to the touch. So she numbed up my stomach and reopened it and had to put this stuff called iodoform in there, which is a sibling to chloroform, to help clean it out and draw out all the fluid and infection. Well, ever since I got that in, I wasn't holding food down, water, anything. So about a week and a half, it was like 10 days, into having the iodoform in me, in my stomach, I went to the gyno again, and she took it out, said it's healing up fine, you can do without it. But how are you feeling? I said, right now I'm still nauseous. She goes, okay, try drinking some water. The water came right up. Now, she's like, okay, give me a minute, left the room. About a minute and a half, 2 minutes later, she comes in and goes, we're admitting you. I said, I don't want to be admitted. I'm 25 miles away from my house. I have nothing with me to do for the next few days or however long I'm going to be in here. I don't want to be admitted. You have to be. No, I don't. I don't want to. So she goes, well, you have to be. So I was playing along with her, acting like I was going to go down to the room. But I knew to get to the room I would have to pass an exit. I tried to go to the exit. She grabs my wrist and pulls me in back and says, you are being admitted. You have to stay. Now, I don't like this because she already made me call Beth from her phone and go, I'm being admitted. Call and cancel my ride home. And so, yeah. Now, I've been sitting in the room for about an hour after this, and the nurses made me get undressed and everything. And they're like, okay, you're going to lay here. We're going to do a CT. That's the only test you're getting done. You're going to be in here for at least 24 hours. Okay. Now, CT does not detect stomach cancer. I know this for a fact. I've had multiple CTs done. And the doctors and nurses tell me I can't leave. Now, I've had CTs in the ER, outpatient. Why do I have to become inpatient for one CT? Makes no sense. So, I pretty much go and say, this is bullshit, I don't want to stay to the nurses. They come in. And they're like, well, you have to. And I'm crying because I don't want to be there. I'm having a panic attack. And finally, it's about an hour after that, an hour and a half after I get into the room, Beth comes in. Because they would not tell her where I was. She went into the ER. Oh, not here. Down at the doctor's office. Drove around the building with her mom. Not the doctor's office. She's at the emergency room. Oh, no, she's in med-surg. So they were going all around. They're not telling her where I'm at. What room, nothing. So finally she finds me, and I'm still crying because they won't let me leave. They told me I can't leave. Now, at this point, all I know is she's coming, and I need to get out of there because I did not want to be there for nothing. So once she's in the room, I call my nurse. Her name's Jeannie or something. And she comes in and goes, what's wrong? You were all smiles until she got here. No, I've been crying, telling you I want to leave for the past hour and a half, 2 hours almost. Like, she's talking down to Beth now. They were rude to me since I got in there. I wanted out, and they weren't going to let me. She keeps telling me, trying to, like, brainwash me, it's for your best interest that you stay for this CT. No. So, I knew that there was going to be a problem if I tried to walk out on my own with Beth. So I had Beth go find her mom. Bring her mom in so that they wouldn't start. So what we did was, once her mom was in there, I got dressed, I got out of there. As we were about to walk out the door, I handed my hospital bracelet off to a nurse. I said, tell them I'm not coming back. And walked out. And literally, with those 2 hours roundabout, from the time I was admitted to the time I walked out, against hospital's authority, or whatever you want to call it, I was able to eat a chicken sandwich and chicken fries from Burger King and have a soda and keep it all down. Have not had a problem keeping anything down, except when I take a certain medication that makes you nauseous. So guess what? I changed my pill and I'm fine. So I thought about changing doctors and everything. Right now I have to go through this surgery with who I have because it's the best in the state for gynecological oncology. Dr. Gordonier or something like that, with Norton Healthcare. But I will be okay. I did get some good news though on top of everything. After the new year and after my surgery, so probably March or April, sometime around then, my father and maybe 2 of my uncles will be coming out to visit. They want to make sure that I'm not dying, that I'm okay, because as soon as I found out cancer, I made the call to my father, my aunt, the people that I care, that I know care. My father, my Aunt Donna, who's on my mom's side, Keith, who's a close family friend, and a few other people, not many. Most people I updated through the computer. I've kind of been MIA from Facebook and YouTube because I really just want to try to get my thoughts clear enough. If you give me a second, I will show you my scar, and that will be it for this video. Okay, so this is the scar, and down here it kind of looks like pretty much like a butthole. Sorry to say, my whole stomach looks like ass the way they had to do the cut, but yeah, so that's about it. Sorry this video is so long, but yeah, try and keep updated more often now.